I just wanted to talk a little bit about what happened after the fiasco of me delivering my baby and then losing my uterus and almost bleeding to death in front of so many well-educated medical professionals, just because of medical malpractice and neglect. So after all of that was said and done, I was very focused on breastfeeding my baby, so I was refusing all pain medicine. And I was in extreme pain because I was split open vertically and horizontally, and I had huge hematomas in my abdomen. We're talking bleeding all the way up to my liver, and I had fluid overload to the point where I had fluid around my heart sac and in my lungs. And my legs were so edematous that I couldn't even feel them. Like I thought the epidural was still in place just because of how fluid overloaded they were. And to the point where the ICU staff thought I was obese. And I think that might be part of why they were treating me so bad. Like, you know, all of this was my fault anyway, so why am I so pissed off at medical staff? It's like, I wasn't obese. I was working out. I was deadlifting 100 pounds the day before my water broke 30 times, as well as squatting that much, as well as pushing a heavy sled. So definitely I wasn't obese. I was very strong. I was very fit. But it was just amazing to me how much they treated me like crap. And they also kept harping on the fact that I had anxiety, because that's what I labeled my feelings as, because I was trying to describe to them when I was hemorrhaging in the ICU still after the embolization. I was like, I feel like I can't breathe, like I can't extend my lungs all the way. Well, it was because I was fluid overloaded and I had blood all the way up to my liver. So I couldn't expand my lungs all the way. My abdomen was getting bigger and bigger, and I kept saying, it's bigger than when I had the baby inside of me. And nobody cared. They were like, well, that's because you were pregnant. It's like they wouldn't listen. It's like, no, it's larger than when I was pregnant. And the baby's out of me now. It makes no sense. And it was firm. Nobody cared. And the pain was worse than labor, and I kept telling them that, and they would not listen. I also had bruising around my belly button that was getting worse, and bruising along my flanks, which was getting worse. Nobody cared. Amazing to me at a trauma level 1 hospital. What else was I going to say? There's a plane coming. So I was telling them I was having a hard time breathing, and I was like, I don't know. They're like, do you have anxiety? I'm like, I don't know, maybe. And I was like, I don't know what to explain this feeling as, but I cannot take a deep breath. I can't slow my breathing down, because they kept telling me, try to slow your breathing down. I was breathing 40 times a minute. You know, that's not normal. My heart rate was very high. My blood pressure was very low. All signs of catastrophic hemorrhage. Nobody gave a crap. My hemoglobin dropped twice. Wasn't until the second time, which, by the way, they didn't check my hemoglobin frequently at all. It was like they let me go a whole day, and then they finally checked my hemoglobin again, and they were like, oh yeah, it is really low again. Maybe we should CT her. So, you know, I think if they had been more on it in the ICU, maybe I could have had some intervention done to my uterus to save it. Because I think by the time they had to take my uterus, they couldn't see anything because it was so swollen and bloody in my abdomen. They even charted they couldn't see my ureter, so they were trying to basically blindly cut out my uterus without affecting my ureters, which is complication you can have from a hysterectomy. Thankfully, I guess my ureters are fine. But, you know, it's like the hospital wants you nearly dead before they'll do anything to you. And like I said, they kept harping on me being anxious, and my blood pressure would go through the roof. And then they were trying to diagnose me with postpartum hypertension. The blood pressure going high happened after the hysterectomy. And they were trying to say that I was having hypertension. And I said, no, it's only when people come into my room that it gets high. It's anxiousness because I just almost died. And you guys, every time you entered the room, would hurt me horribly. So my body is in still this fight or flight. It's like I couldn't explain common sense to them. Like, I'm still in this fight or flight, and every time you enter the room, I go into this tense state that I can't really control. And so they're like, oh, you have anxiety? I'm like, I guess you could call it that now, but not usually. It's just because of this situation that's happening. Anyway, I had a pain doctor come in who was great. And I was explaining that, and this is after the hysterectomy, when I had the vertical and horizontal incision, I was saying that my pain was horrible and it was like a rhythmic contraction. It felt kind of like contraction still, even though I had no uterus. And I was like it's a wave that's going across the vertical incision in my stomach. And I'm like, I don't know how to explain it, but it'll take my breath away and I have to just like breathe through it when it's happening. And he said, that's probably muscle spasms because your abs had to be split so far up. And he said, I think what we should try is Valium. Because I thought he was going to ask to start a muscle relaxer because it was muscle spasms that were happening. But he said, no, he wanted to try Valium. And he said, and he was also encouraging me to take pain medicine. I also had nerve blocks in my abdomen on both sides that were leaking. And those caused me trouble too. But he was like, you really need to take pain medicine because you need to move and you're not going to move if you hurt this much and you've been through a lot, so you should take some pain medicine. I'm like, I want to breastfeed, and this is nothing compared to the pain of having a perforated uterus getting pushed on all the time. So it's like, it's not like I wasn't tough. It was, as far as getting the epidural during the birth, it's that I had an extreme pain during my birth. I gotta check something. And I think also part of me wanting to avoid pain medicine is I wanted to be in control of my thoughts and speech and stuff. And I wanted to be taken seriously. And I think maybe I was also punishing myself for getting the epidural in the first place because I was like, gosh, that led to a C-section because I couldn't move. And I'm like, this isn't as painful as the rest of my birth was. So I should just deal with the pain now. But of course, getting up and moving wasn't really happening. So I did eventually start taking the pain medicine they were asking to give me. And they would give me a low dose because I was breastfeeding. Anyway, he offered Valium. And he said, that's probably better than the opiates because you're having muscle spasms and that should help treat it better. And Valium is a medication used for a lot of things. It can be used for anxiety. So that just also reinforced the idea that the ICU doctor had that I had anxiety. Oh, she's being treated for anxiety with Valium, which is insane. You don't usually treat anxiety with Valium unless it's severe. That's not why I was being given Valium, and I didn't have extreme anxiety to the point where I needed medication. The only time I asked for something for anxiety was when they were going to pull the Jada out, and the OB asked to just take it out without giving me any pain medicine. I'm like, every time they push on my uterus, it kills me. Can you just give me something? And she wasn't going to. And then I told her how I couldn't breathe very deeply and I couldn't calm myself down. I couldn't get control of anything. It's like I felt like I was drowning, like I had this much, like the water was coming up and I was just trying to take my mini sips of breath at this top of this, lung fields. So she was like, oh, you have anxiety? She's like, do you need anxiety meds? I'm like, something, because I cannot control myself mentally. Like, I don't know what's going on. So she did give me like a little bit of, like a very small dose of Ativan and then some morphine, like a small dose. Like I've given kids this dose before. So, and then she pulled the Jada out, which she told me is like, oh, it shouldn't cause any pain. Of course it caused pain. It was coming through a lacerated uterus and a lacerated cervix and vagina. And even if it wasn't coming through a perforated reproductive system, it was putting pressure on my body and now it's being removed after I've had this huge bleed out. So of course it's going to hurt. So anyway, they always lie about pain. So I was glad that I had that. And then when they told me after the CT scan showed that I was still hemorrhaging and they're like, we got to take your uterus, I asked for a little bit more medicine because I knew I couldn't tolerate it, going down for a hysterectomy and being moved in the bed and everything. It was extremely painful. Even just moving to the CT bed was excruciating. I was literally screaming. My sister could hear me down the hallway. And I'm not somebody who does that. Like, I'll be very silent while you're torturing me, usually. Yeah. So, anyway, the ICU got it in their head that I was just like this anxious, obese person. And they were treating me really bad because of it. And then just recently I looked through the notes and it was talking about patient has anxiety, was treated with Valium. I'm like, that's not why I got Valium. It's like they never spoke to each other or understood each other. the different doctors and disciplines and stuff. So, that just makes it harder on the patient when the medical team can't even get their story straight. And I was the only one keeping everything straight for everybody, and it's like, some of them would listen to me, most of them wouldn't, and then it was like an uphill battle. And then this pain doctor's like, yeah, you can take this Valium dose, it's going to be like 2 milligrams, and it's nighttime, so I'm not going to see the baby anymore to nurse her. And he said, honestly, you could feed her again in about 2 hours if you wanted, because the dose is so low to begin with, and it leaves your system super fast because it's IV. But if you want to be safe, you can wait longer if you want. Then the ICU doctor, after this pain doctor sees me, comes in and he's like, I'm not going to give you that because you're breastfeeding. And I'm like, first of all, I'm not making any milk right now. So if my baby would latch on me, she'd be getting drops, Second of all, I'm not going to see my baby for the rest of the night, so I can have that. And third of all, the dose is so low that the pain doctor, who's knowledgeable with this medication, he's totally confident giving it to me. And, third of all, it's not your business as a doctor to tell me I'm not giving this to you because you're a mom or because you're breastfeeding or because of, it's like, that's not your primary concern. Your concern is taking care of your patient. So anyway, like, it was safe to breastfeed with the dose I was given. And he said if I wanted to be extra safe, I could wait 2 hours. Mind you, I'm going to wait 12 hours because I'm done seeing her for the night. So that was a hurdle, just to get the doctor to finally give me some Valium, which, by the way, hadn't had pain medicine that whole shift because I was trying to breastfeed and I was trying to prevent giving myself pain medicine. And I think I also felt guilty for taking pain medicine in labor, which the only thing I took was the epidural and the walking epidural. But so I was like punishing myself for going through what I went through. And so it's just a hurdle after hurdle to get the doctors to talk to each other so that I can get the treatment that I need. And once I got Valium, I wanted to sleep because I hadn't slept, It was the day before labor, I woke up at 4 a.m. and worked out really hard at the gym. The day of labor, I woke up at like 1 after falling asleep at noon, or midnight, I mean. And so we're talking 48 hours just for the labor with very, very little sleep, couple hours total. And then I have the hemorrhage, which is more time awake. And then I have this ICU stay, which is more time awake. So the Valium, I was only really taking it not so much for the pain, but to try to force myself to sleep because I was so anxious. I guess I'll call it anxious, which anxiety is not a bad word. It's like every human will experience anxiety at some point in their life. It might be when you're being chased by a bear, it might be when you're in social situations, it might be when you just hemorrhaged almost to death and now you're still in the care of these same kind of people. Good luck getting that across to any dense doctor. So I had to explain things like I would to a kindergartner of what I was experiencing because they just would not understand. So anyway, I let them call me anxious because it's like, whatever, you got to decide in your head to start treating me empathetically. I'm not anxious. Like, I'm a flight nurse. I work in high stakes situations all the time and I don't ever lose my cool. I'm not this like anxious, scared person. It's just that I just went through something horrible. And I'm still going through horrible things. So anyway, physical therapy started working with me in the ICU. I was able to start walking. There was a period of time in night shift when I needed to use the commode because I had asked repeatedly for diuresis, like Lasix, so I could get all this extra fluid off of me because they gave me 10 liters of LR in a 24-hour period, and I had fluid around my heart and my lungs. And so huge of like stomach and legs that I couldn't even feel my legs. And they were like, no, we're going to let you diurese yourself naturally. Let your kidneys do their job. I was like, okay. And I had the catheter in place at this point. Well, my bowels started waking up and I didn't want an infection. So I asked for the catheter to be removed because I was starting to have UTI symptoms, which they would not test me for because they said it ruins their statistics. To have a CAUTI, which is catheter induced or whatever. I can't remember all the acronyms now, but it's like you get an infection because of having a catheter inside of you, and they don't like that, and that makes them look bad, and it affects insurance, paying back for things and stuff. It's kind of on the hospital, and the hospital has to pay more money, so they don't like that. So they won't test you. So anyway, I got the catheter removed, and then trying to go to sleep after taking my Valium. Like, I'm going to get some sleep now. The baby's taken care of in the nursery. I'm going to finally, like, exhaust myself and go to sleep after this surgery and horribleness. And they're like, oh, we're going to give you IV Lasix. It's like, oh, on night shift. Yeah, you're too fluid overloaded. I'm like, yeah, that's what I said all of day shift, and nobody wanted to give me anything. Well, we're going to give it to you. So then I peed 8 liters in 2 hours. And my nurses were like, we need to get you up. You need to go to the bathroom for that. And I'm like, no, I'm not getting up for that because I can't feel my legs. I'm like, you need to just put a Pure Wick in me, which is like a sponge on a vacuum. And you just piss yourself all night. And I filled up that canister multiple times. And it's like they didn't believe me. And it's like every day my family would see me, they're like, you look so much better. Because I went from like having no neck because I was so fluid overloaded to, being thinner again and being able to breathe again and feeling so much better. And then slowly as I received all the blood that I needed. And I got blood during the hysterectomy too because I bled out another 6 or so liters. Because they had to remove all the clot and the hematoma, and then I also bled, they said, 2 liters during the case, so it was a total of about 6 or so. So that's where I come up with the 12-liter total, which might be an underestimation because my embolization notes say I bled 8 liters prior to being embolized, and then hysterectomy was like 6 or 7 liters, so it's like, I don't know. I say 12, but that's probably an underestimation. I got 22 bags of blood plus other blood products and then the 10 liters of fluid, which is insane. So anyway, where was I going with this? So yeah, I'm trying to go to the commode at one of these points to pee. And because my bowels are waking up and stuff. And I'm just sitting on the edge of the bed. And I kid you not, I sat there for an hour waiting for my nurse to stop scanning meds. And I don't know if she was just stupid that day. And I feel bad because she was nice, but there was 2 nurses in my room. Neither of them helped me. They were both like fastidiously trying to figure out the pain pump that was it's like lidocaine, it's like bupivacaine or something, and it's into my muscle in my abdomen. That was going off like crazy. There was air bubbles in the tube. They were trying to finagle it, and then they were trying to like unscrew it from my actual catheter, and it was stuck because probably fluids got on it and kind of glued it shut. Anyway, the 2 of them together were like messing with all this stuff, and I had to pee so bad. I was like, please just help me to the commode. And they're like, yeah, let's just do this first. And they kept saying that. Just like in labor and delivery, it's like you think that they're going to help you and listen to you, and they don't. So I'm sitting on the edge of the bed for an hour. Mind you, I had DIC. So that's when you're clotting and bleeding all over the place because you've bled so much that your clotting factors are now affected. And I ended up with the hugest hematoma I've ever seen in my life on my crotch. And it's just because of that dependent state that I was in because I was sitting on the edge of the bed. That hematoma was all in my crotch. And it looked like a bunch, like a giant bunch of bananas that was completely black. And that was like the next day I saw that. And it was so painful. And I asked the OB, I'm like, is this necrotic now? Is this going to fall off? I was like, oh my God, what happened? Because the days before I didn't have that. They're like, oh, it's just because, your hematoma is being reabsorbed. You had DIC, dependent edema, blah, blah, blah. So I would like try to sleep with my butt in the air, like reverse Trendelenburg, to try to get all that fluid off of me and all that hematoma. It was horrible pain, and it's like I wouldn't have had that if they would have just helped me to the commode and then helped me back into bed and then scanned all their meds. But they couldn't figure out how to do that because they're slow and stupid. I don't know. So I don't think I had good care at any department in that hospital. There was a few nurses that I didn't really have to work so hard to explain things to, and they seemed to have some intelligence, but most of the time I just felt like, God, where did you guys come from? How did you pass NCLEX? How did you get your license? And same with the doctors. Like, you're a medical doctor and I have to explain this to you. So, there's a plane. So then I was with this huge hematoma and being diuresed multiple times. They gave me this IV Lasix to pull off the extra fluid. And after diuresis started, mind you, I should have been on eyes and nose from the beginning of being in that ICU. They never weighed me once I got to the ICU. When I arrived to have my baby, I was 210 pounds, given some about that. Prior to getting pregnant, I was 160 pounds. I'm 5'8", and I'm muscular, so I got up to 210, which is too much for me. I shouldn't have gained that much, but halfway through this diuresis process, I asked them to finally weigh me, and they weighed me at like 240 or 250 or something, and this was after the hysterectomy and after the baby was removed from me, and after diuresis had started. So that's where I get this whole, like, I might have been at least 100 pounds extra, because I came in at 210. They weighed me after diuresis started at 240, 250, something like that. And so I'm like, I was way bigger before they weighed me, so I at least had 100 pounds of fluid on me. So that's just insane. My friend who saw me when I was intubated, she was like, I had to check your wristband because I didn't even think that was you. She's like, you had no neck. You were at least 300 pounds. I was like, she showed me a picture of it too, and it's unrecognizable. And like, my parents saw me like that, with their baby girl intubated and super bloated and looking dead, super pale. They saw me like that. And it's all because of medical error. It's like, who wasn't watching how many bags of fluids you were hanging? And also, when I woke up from being intubated, my nurse, who was ignoring me initially, she was trying to hang fluid on me. I woke up to her doing that because my blood pressure was dropping. The reason why my blood pressure was dropping is because I was still bleeding. And she's like, well, your blood pressure's low. I gotta hang this. I'm like, no, I need either pressor or blood. I don't need fluid. Look at me. And it's like, she didn't understand that I was fluid overloaded. I was like, look at me. I'm like, I had to rip my arm out of the restraint, and it was hard to do because my hand was like a big water balloon. And I guess they just thought that's what I usually look like. But it's funny to me because fluid overload looks very different than being obese. No obese person has water balloons for fingers and hands and toes. That's something you only get with fluid overload. So it's like, you guys can't even tell the difference between water weight and fat. Crazy. It's like, who wasn't listening to my lungs? Yeah. And then I look at like my labs that I had to, like my pH, my CO2, and it's like, okay, my vent wasn't always managed correctly. They weren't paying attention to my respiration rates there. Like, there's so many other times where things could have gone really south and somehow I'm still alive. It's like, there's so many ways I should have died and somehow I'm still alive. And part of it is because I can advocate for myself and I'm strong and I'm healthy, but some of it I think is just luck. I'm also religious. Like, I prayed while I was hemorrhaging to death, and I asked for God to help me through it. And then I felt peace. And I have to say, if you're worried about death, I was so, like, at peace at one point when I was hemorrhaging, like before the embolization happened. After I woke up from her perforating my uterus, I asked for the anesthesiologist to put me under because I was okay with dying. I was like, just put me under, because it was so scary to be in this state of like, I'm bleeding to death and I could barely breathe and I had horrible chest pain, and I was like, just put me under, please. I don't want to be conscious for this. And I was like, well, if my blood pressure is not good enough, I guess I'll just suffer through it. But he said, your blood pressure is a little better, because they gave me 2 units of blood and some fluids at that point. And so he allowed me to be put under. And then, like I said in a previous video, it's probably a good thing he did, because my blood pressure got down to 40 systolic, according to the rapid response team. And my pH was 7.066. So, and my blood hemoglobin was 4. So it's like, if he hadn't intubated me, I'd probably be dead, because I would have lost my ability to breathe, and then that would have been a panic. And it's like, you don't want too many things going wrong at the same time, especially on night shift, because you're not dealing with the best of people necessarily. And it's amazing how unprofessional professionals are. You think you're in good hands in the hospital, and I can tell you as a flight nurse, you're probably not. Like, they're probably missing a lot of things. They're probably doing a lot of things wrong. So, the idea of just like sitting back and relaxing, I couldn't relax throughout my entire care because I knew what they were doing wrong. And all those things add up. It's like, if you can get your stuff down to an art, you can save people. You can swipe them from the jaws of death, as some people have said in my career. But if you're not good at what you do and you're fumbling and you're delaying certain things, your patient, all their extra reserve they have for staying alive, it'll run out and they'll die. And that almost happened with me. So it's really spooky to think about. Anyway, I was talking about the ICU stay. So yeah, I got this huge crotch hematoma. And then 2 of my staples had popped out at some point. And I think that's because they didn't line the skin up right. I have this wrinkle in my stomach because the 2 ends of my skin are not perfectly aligned. And my C-section scar's like pulled up to one side because the vertical incision wasn't closed correctly. And so because of all that pressure from the swelling and the skin not being lined up, 2 of my staples popped out. And then the same doctor who screwed me up, she was on again, and she was supposed to restaple me and assess me. But I guess she had already left to go home or something. I don't know. So she sent her nurses, and I don't know if that was just because she didn't want to deal with me anymore, or if she was embarrassed to come talk to me. I don't know. I'm amazed she didn't come around on me after putting me through all that. Apologies go a long way. And especially if you look at lawsuits, it's like, if you can apologize to your patient and level with them, it's not going to be as bad. But if you just totally don't take any blame and you ignore them, that's not doing any favors for you with as far as lawsuits go. So anyway, I had two pop staples, and they just left them out because they're like, well, at this point, it's better that it just heals from the inside out. And I was at high risk for infection, and they were predicting that my wound might dehisce and then I would need a wound vac. Thankfully, that didn't happen. But with the 2 staples popping, that definitely made it worse. And also, I was asking for a chlorhexidine wipe down, and the nurses brought out chlorhexidine wipes instead of like the CHG little like squishy thing that you use for central lines. And their wipe got caught on one of the staples before it got popped out. So I think that's part of what caused it to pop out. And it's just like everything they did was bad and wrong. And so I started doing my own chlorhexidine wipe downs. And once I got home, I actually started using iodine because I was really afraid of having infection because I was kind of oozing still. And thankfully, I didn't end up having an infection, but I was scared of that. And it's not because they helped me avoid infection. It's like they were doing everything they could to give me an infection. They were like reusing the same cloth in multiple areas. And I'm like, you got to toss that one. It's contaminated now. They were taking my contaminated bucket and putting it next to my bottles that I had sterilized, like had my husband sterilize. And I'm like, yeah, that's wound stuff. You need to put that on the fucking floor or throw it away. Like, not next to the bottles, you fucking idiot. That happened in high-risk maternity. And also in the ICU, because we had like a bottle station that we were trying to keep clean, and a pumping station stuff that I was trying to pump all the time. Yeah, but they were like draining my JP drain and then putting the little cup, they put the JP drainage right next to the pumping stuff. I'm like, what the fuck is going through your head when you think that's okay? It's like stupidity constantly. And then, yeah, they were always trying to diagnose me with postpartum hypertension. But I didn't have that. As soon as they would leave the room, my blood pressure would go back to normal. But if I would talk about what just happened to me, my blood pressure would get into the 210s over 100 somethings. And so then they were all freaked out about it. And I got a dose of labetalol at some point. But I was so afraid of taking anything for blood pressure because I knew what it felt like to be low blood pressure. And I'm like, they're probably going to over-medicate me. And then I'm going to be falling out, So I'm like, just let me naturally come back down. I can calm myself down back into normal blood pressure. And I would 100% of the time. So, my nurses were annoyed with me because they're like, I just need to give you this labetalol. I'm like, can I have half of it? And you can just see how I do with that, because they were trying to give me like larger doses. And I'm like, I don't usually have blood pressure issues. And I know I don't have preeclampsia. What I have is, you guys just tortured me and I survived. So now I'm like highly susceptible to being stressed right now. but they just couldn't get that. They're like, no, I think it's this other thing. None of my labs indicated that I had like eclampsia or anything. So anyway, it's just like fighting battle after battle and trying to convince them of common sense. And then I asked for, I finally got transferred to high-risk maternity. And mind you, I was only able to see my baby twice a day at most during the 4 days I was in the ICU and trying to latch her and stuff. And I was telling the nursery nurses not to give her binkies and not to give her bottles because she latched well after the C-section. I was trying to breastfeed. And then here comes this nurse from the nursery with a binky in the baby's mouth, and she's been bottle feeding her. She's like, well, I just fed her. I'm like, why would you do that? Like, I'm trying to nurse her. And I was like, you guys are supposed to use like the syringe in your finger. She's like, well, that's high risk when they get into these larger volumes. I'm like, no, it's not. You just need to not push the syringe too fast. But she didn't want to do it that way. So I felt like beggars couldn't be choosers. I couldn't bitch about the, binky. I couldn't bitch about anything. To this day, my kid still has a binky. It's like, I just couldn't deal with weaning her off of that because there were so many other things I had to deal with. So I just accepted whatever they were doing with her. It's like none of my wishes were ever respected. So, and latching, I ended up having to use nipple shields because she got so used to binkies. And then that was like a 3-month endeavor to get her off of nipple shields. So it's really important not to do that if the mom's trying to just breastfeed. And it's like, I had no issue when she was first born. It's just because of you guys that she's having issues now. So, and there was one point in the ICU where they're like, yeah, we can't come down and visit because we're too busy. We don't have the staff. So then I asked my ICU nurse, I'm like, can we go up there? Because I used to do that for my cardiac ICU patients who had babies. I would take them from the ICU and go visit their babies in the NICU. And they, I guess, weren't expecting that I would even suggest that. They're like, crap, that's going to be a lot of work because now we have to move this whole ICU bed and all these pumps and stuff, which I was an ER nurse. Like, I could do that all day long. It's no problem. But, these ICU nurses don't like doing stuff like that. So then all of a sudden the nursery nurse could come down and see me. I was like, oh, like, hello. And I've worked really hard, like in the South, way worse ratios than we have here in California. So when these people are like, oh, we're understaffed, it always pisses me off. It's like, you could work harder. A lot of nurses whine about ratios, and it's usually like, if you can get on the computer and talk about it, about how bad it is, it's probably like you're not working hard enough, because I would just do the job of like 4 nurses and have no problems, and then my coworker who's like barely able to manage their ratio is complaining. But some people I don't think were built for healthcare in the first place, so that's part of the problem, is we let too many people in through nursing school and through medical school, like my doctor who sabotaged me. So anyway, I was like super healthy, wanted a natural birth, and then they totally screwed everything up. Wanted to breastfeed, I still am breastfeeding, but they really sabotaged that. So, having hospital intervention definitely can set you up for failure, and I don't think people talk about that enough. Thank you. Here you go. And I was feeling like really guilty because my baby was separated from me for 4 days, and there was like one meeting time where I was like, I just can't see her right now, because it was like person after person was coming through the door. Mind you, I used to work in a cardiac ICU where my patients were hooked up to all kinds of devices and drugs, and I let them sleep. So I don't know why they interrupted my sleep so much, and it was just stupidity. It wasn't because it was necessary. It's like when I was dying, nobody wanted to see me and talk to me and listen to my complaints, but when I was safe, everybody was in my room. I was getting magnesium drawn all the time, even though my magnesium was stable for multiple days. And I had to tell a doctor, hey, can you cancel that order since it's been stable this whole time? And now that I'm eating, I don't need to take these IV potassiums anymore. I don't need to take oral potassiums anymore. Like, my potassium is rising now that I'm not so diluted, because they were giving me Lasix, and because I had so much fluid on board. So it was like erroneously showing that I had low potassium, and then my potassium was like steadily getting more normal. And it's like, please stop medicating for this stuff, because it's not necessary. What I needed when I was in the hospital was blood. But they couldn't manage to do that. But my God, they will shove fucking potassium through your tiny little IV that's infiltrated over and over and over again. And I had horrible phlebitis from my IVs just going to shit because of DIC and because of them putting the wrong thing into the IVs that were too small. So I couldn't like extend my arms all the way because my veins were so tight from the phlebitis. So that made it harder to hold the baby. And of course I have this vertical and horizontal incision, so I'm trying to like hold her this way so that she can breastfeed, and my arms are just horrible pain. So I kept saying to my mom, it's like, there's not one part of me that hasn't been affected by this birth. It's like every part of my body is destroyed right now. And, you know, I'm such an independent person, and it just broke my heart to not be able to care for my baby totally. Like, have some nurse put a binky in her mouth and change her roughly and do all this stuff that I didn't want having happen to her. And they would always say, oh, she's got a set of lungs on her. I'm like, yeah, because you guys are making her cry. You know, she needs her mom. She needs to be calm with me. And it's like, as soon as she was with me, it was like taking Valium, honestly, because I've taken 2 doses now. It was so calming to have my baby on my chest. And it's like, if you guys would just put the baby with me, I bet my blood pressure would be fine and everything else would be fine. And then I started making milk pretty quick. And the baby was in the nursery for 4 days, and she got some supplementing with my previously pumped breast milk when I was pregnant, and also with donor milk. So I was upset that I wasn't able to provide her milk like I wanted to, but I was pumping all the time trying to get my supply up. And my husband's in the military, and he had his military guys go to our house and pick up my lactation cookies and stuff, so that was nice. So I ended up producing milk pretty quick once I had enough blood in my body to do so, and blood pressure and everything. And then it was just amazing. I was so impressed with my body, because it's like, even though I'm dying or was almost dead, my body still knew there was a baby to feed, and I started producing really good breast milk and colostrum. It was super orange yellow color, and I was almost like, maybe it's like very iron rich because of all this hematoma I have to absorb. And I had no appetite. I didn't eat for like 4 days or so. Like, even eating Jell-O would make me feel sick, so I just didn't eat anything. And they're like, you really need to eat. And I'm like, no, I don't. And it's like, you just need to listen to your body when you're like that. And, you know, animals, when they're super sick, they won't always eat. I want to say too, like, the one doctor I had in the ICU was very rude once I was extubated. He was like, he came in with his his arms over his chest and like folded, and he was very glaring at me, and he's like, you know, we're trying to help you, and he's like, you should be more appreciative. And I was like, he's like, we saved your life, you should be more appreciative. I'm like, you should have saved me faster. You know, like, I just wouldn't give him anything, because I was like, I bled out for 2 hours before any blood was hung, as I was begging for blood, as I felt death approaching. I had to pause to change her diaper and get her a snack. So I'm waiting for the snack to heat up. I've meal prepped a bunch of stuff for her, and I put it in the freezer, and then I microwave it so that she can have it whenever she needs it. So the doctor was super rude, and he's one of the ones that charted me as being obese. And he just, I mean, he looked at me like I wasn't human, and was pissed off at me for getting upset about the events that transpired prior to him taking me as a patient. So something he wasn't present for, you know. And he even said, when I said, I need like ultrasound of my leg because I think I might have a blood clot because it was so swollen compared to my other leg. And he was like, I'm not concerned with that. And I said I needed like an EKG of my heart because I had horrible chest pain while I was bleeding out. I'm not concerned with that. I'm like, well, I am concerned and you need to order it because I don't even think I told him there would be a lawsuit, but I was like, a lot of bad stuff happened to me and you need to investigate this. And so he did order these things. And I got a chest x-ray too. It's like finally they did a few things, but they didn't do a CT. He didn't check to see if my hemoglobin was stable. Like, it was just really bad doctoring. Then the next doctor took over and gave me some blood because my hemoglobin was low after he checked it. And he checked me for DIC and he said I didn't have DIC. And then he checked my hemoglobin hours and hours later and it was low again after getting another unit of blood. So then he started 2 more units of blood and ordered the CT. And that's when they saw all the damage. And he was actually nice, but it was kind of like common sense. Like, that's the first thing you should check is my hemoglobin, given all my symptoms. And he checked me for ileus too because I had horrible stomach pain. And that's what he thought it was. And then he was empathetic. He felt sorry for me that I had to get a hysterectomy. He's like, I have bad news for you. And I'm like, shit. And then while my dad's in the room, they're telling me that I'm going to get a hysterectomy. And I was asking to keep my cervix. And I like had questions about hysterectomy. How does that affect me as like a young woman? And, you know, my dad's in the room. So that was not ideal. So anyway, there was also a rapid response. There was 2 rapid response people. One of them used to be a combat medic in the army, I guess, and he was a dude. And then the other was a woman, and I think she also was military previously or currently. And she cared a lot about me. She was like, did you hear me screaming in your ear that you have to survive for your baby? And I was like, no, I don't think so, but I did have a dream that I can't remember. He was also amazed that I was alive, but he was telling my mom not to take pictures. And he was telling me that every hand that was on you was trying to save your life. He was like trying to convince me to stop being upset. And I'm like, that's great that day shift was like that, but night shift was not. Like, that's what I'm telling you. And then I also talked to the night shift rapid response team member who had ignored me. When I asked her if there was another doctor available, she just ignored me. I'm like, why did you ignore me? She's like, oh, well, because... I was like, why wasn't there another doctor? She's like, another doctor doesn't usually come to OB rapid responses. And I was like, you know, if something's going wrong to the point where you need a rapid response, I think another set of eyes is a good idea. Because there was no reason for her to keep denying me blood. And the rapid response even asked, do you want to start a mass transfusion? And she said no. So after they knew my hemoglobin dropped from 13.1 to 6 point something, she still didn't want to order a mass transfusion after all that time it took for labs to result. And then once they started to get blood on me, they checked with a hemostat checker and my hemoglobin was a 4. So it's just bizarre. It's like, you guys really need another doctor showing up to those things so that they can have a fucking fight to save the patient instead of just one doctor getting away with murder. But yeah, the guy rapid response person from day shift, when he saw me once I woke up, he was like trying to convince me that what I was believing wasn't true. Like, oh no, people really wanted to save your life and like we did everything we were supposed to. And I'm like, okay, maybe day shift did. Obviously I'm still here, thank God, but night shift did not. And I should be dead because of that. And then he tried to put an IV in me at some point because, you know, I had horrible phlebitis. Never got a central line, by the way. And I was on pressors the first day that they woke me up, you know. And he couldn't get it. He was, like, jamming it into my ligament. And I was like, okay, that hurts. And he's like, okay, I'll stop torturing you. Because he was all bragging about the fact that he used to be a combat medic and he's so good at IVs. And then he couldn't get it. And I was like, why don't you just put an IO in? Like, even in the ICU, I was like, just put an IO in, you know, and that should tell you how sick I am. The fact that I'm willing to let you drill in my bone. He's like, have you ever had one? They hurt. And I'm like, couldn't hurt worse than I feel right now. Like, I bet it feels great for gate theory, you know, because my uterus was lacerated at that point, and they were pushing on it every hour. And every time they pushed on it, it felt like they were trying to rip through my fascia, like, and they were pushing on my belly button area. I'm like, my bruise is getting worse there. And it just felt like they were trying to find my spine. And they're like, I'm not going to massage it. I'm just going to check. And I'm like, you should have felt it by now. But maybe because there was so much swelling, they had a hard time finding it. I don't know. So it was horrible pain, and I started denying them checking me because I was like, I just refuse. And they're like, well, if you're bleeding, we need to know. And I'm like, yeah, just look at my vitals. I was like, you're really hurting me. And this is after the embolization, mind you. They're shoving their freaking arms on me on a uterus that was just embolized, like had a hard time embolizing the right side. And they are just torturing me, pushing on my uterus. And they think, well, all women think this is painful, but what they didn't know is my uterus was lacerated, and who knows if they didn't cause more damage by doing all that. And so I finally told him to stop, and then the doctor was all pissed at me and wanted me to let them continue, and she's like, you could be hemorrhaging, we need to know. I'm like, look at my vitals, check my hemoglobin. You're killing me. It's hurting worse than labor. And, I kept saying all these things that shouldn't cause investigation. And they like stopped the suction of the Jada after a while. And they left the balloon intact, like still full. So all it was a cork. So they're like, you don't have any bleeding out your vagina. It's like, obviously not. You put a cork in there. You need to release that so you can see that there's still bleeding happening. And no amount of uterine massage was going to stop that bleeding because it was a lacerated organ as well as an artery that was cut. Which is why you need to CT people so that you can see where the source of bleeding is coming from. And the embolization proved that there was bleeding from the right uterine artery. Like, he would put the embolization gel foam in and it would go straight to my fallopian tube, which means there's a cut. So then he had to permanently embolize that at the, basically where the fallopian tube was entering the uterus. He had to just permanently close that off so that it would clot. And that's finally when it worked. And then he sent me off to the ICU. Well, then they're pushing on my stomach repeatedly. And I'm like, probably they dislodged the clot he put. And then I filled up with blood and nobody paid attention. And then they had to hysterectomy me. And they didn't even know my uterus was lacerated until the hysterectomy. And then when they pulled the uterus out, they're like, oh, there's a jagged cut here. So then they repaired the vagina. And I'm like, why couldn't they just repair the uterus and the cervix? Why couldn't they clamp the arteries and stitch the uterus back together and then keep it in me? But it's like they couldn't see anything because there was so much blood and swelling and stuff. So they just, at that point, they were like, we got to do something to save her life, I guess, because I keep almost dying. So that sucks. So, and then insult to injury is all these people telling me I should be thankful when it's complete medical error that led to all this. And then when I went to the high-risk maternity unit, and all the while I'm like making reports to the hospital about what happened, and I'm talking to patient advocates and all that. When I went to high-risk maternity, they almost didn't want to take me because I had nerve blocks still in me. And I had just talked to the pain doctor, and I said, how do we take these out? And he was going to take them out the next day. And he said, they're just like IVs. They're just laid on the muscle. So if you just rip them out, it's fine. It's like a little IV catheter. So I was like, okay, good to know. So then when I went to high-risk maternity, they were threatening to not take me and to keep me in the ICU, which would have been bad because that meant I couldn't be with my baby. So I was like, I can just pull these out if you don't want to take care of these nerve blocks. And it's like, there's nothing to a nerve block. It's just a pump running into an IV that happens to be in the muscle instead of in the vein. And so then you just look at the order for the drug, and the drug is like bupivacaine or something. So it's like a certain amount per hour is infusing. And that was just too much for them. They were acting like, we've never seen this before. And it's like, look it up, call somebody. I don't know. I'm not an ICU patient anymore, and I was accepted as high-risk maternity, so you have to take care of me. But they were all freaked out about that, so I was like, I'll just pull them out if you're scared of these. I mean, they were leaking anyway. They probably were causing me more pain than they were helping. But they're like, no, no, no. So instead they just like kept me up for a whole night shift because this dumb nurse took over, and she was like all about policy, but she really didn't know anything. And she was freaked out about these nerve blocks the whole time. The pump was beeping, and she just let it beep because she didn't know how to handle it. And she finally got some ICU nurse in, and she's like, he's nice enough to come down here, like always acting like she's doing me a favor. I'm like, you're a fucking horrible nurse. You don't know how to fucking read an order and look up a med, you know? And then I found out the whole time she thought it was like a narcotic or something. I'm like, no, it's bupivacaine. Like, read it. Just insanity. So, you know, she's not letting me sleep, and at that point I think I took that second dose of Valium to try to sleep, and she was like lecturing me on how I need to try to sleep. It's like, I've been trying. There's people in my room constantly doing stupid stuff because they can't figure out their job, you know, and they're not consolidating care at all. So yeah, she got the ICU nurse down to help change out bags. And then she called him again because it was causing more issue again. And I was like, yeah, it's leaking. Let's just take these out. And then she finally got him to help her take them out. And then she wanted him to chart it. And he's like, no, this is your patient, your medication. You need to chart this. And she was all worried that, you know, she's going to lose her nursing license or something. It's like, nobody's asking you to do something crazy. You know, just fucking stupid. So, like nurses that can't just like pull themselves up by their bootstraps and figure things out. But you know, it's not like we're asking her to do a procedure. You're giving a med you haven't given before. So look up the med, call pharmacy. You know, there's resources. You can't just not do your job. So then they just pulled the intramuscular IV out, which is what I had offered to do from the beginning. And, you know, it just continued to ooze and leak for like 2 days later because it was just pooling above the muscle. It wasn't like in the right spot anymore. It got tugged on or something. Probably could have caused infection. And the pain doctor did say they were used beyond what they're supposed to be used for. So he was really like, we should probably take these out the next day. So I'm fine with the fact that they were removed. I just wish that they would have removed them when I said just take them out. But she was so scared of them. Don't be fearful as a nurse. Just, you know, educate yourself and figure it out and do it. You know, go use your resources and do your job. And she was really rude to me, really in my face, and she was arguing about how much blood I actually lost because all she read was prior to embolization. She's like, I think you only bled 7 liters, which, by the way, is more than what your body has. So that's about almost 2 times as much as what your body has. I'm like, no, I bled like 12. I'm like, you have to add it all up. She's like, well, I haven't had time to like read through your whole chart. She's like, you know, when my husband was dying of a heart attack, I wanted to kill the nurses by the time we were done with them, and they saved his life. And I'm like, okay, we can't relate because the nurses and doctors were actually killing me. You know, they weren't saving my life. What I had happen was not a natural thing. And I knew this once the hysterectomy was completed because the doctor who did the hysterectomy, who was a gynecologist oncologist, who's a real surgeon, you know, really good experience, not just your average OBGYN, she was like, yeah, we've seen this kind of laceration with Jada's before. And then she also talked about the perforated artery and stuff. So it's like, oh yeah, clearly this was medical error, surgical error. So I knew at that point, like, oh, this wasn't my body not clamping down like it was supposed to. She said, your uterus was so clamped down that I had to open you vertically so I could see into your pelvis. So, you know, 2 days after this horrible birth, or 1 day after this horrible birth, you know, I still have a clamped down uterus. It's like, I never had a boggy uterus. I didn't have atony. That's not the cause of my bleeding. And then it makes me wonder, because they say, you know, your number 1 cause of hemorrhage is uterine atony. I'm like, I don't believe any of these statistics anymore, because that's what I was diagnosed with. And I don't know how in-depth medical examiners are when they look into the cause of death for hemorrhage after having a baby. Because I bet all these women who died of uterine atony actually died of surgical error and artery lacerations. And that's a fixable thing, you know? We don't have to die from that. We don't have to lose our uteruses to that. So it's very annoying that that happened to me. And it's like, if any of my other organs were damaged, a surgeon would have to fix it. But because it's a uterus, we're so used to just pulling the uterus And if you read this book, Birth, The History of Birth by Tina Cassidy, it talks about like how surgery has evolved over time and why we do the things we do now. And it's just eye-opening. So, yeah, we haven't evolved much. There's so many. I think if we treated postpartum hemorrhage like trauma and we imaged people more, and we used, high advanced technology like embolization, we could save so many people. And Mexico, I guess, has a better mortality rate than us, which is kind of embarrassing. It's because they have less C-sections. It's like, what does that tell you? It says to me that our mortality rate's man-made. It's not biological. It's not, we're killing women. We're cutting them like lab frogs, and then we're not saving them when we cut the wrong thing. So anyway, this is becoming a long video, but I just want to talk about all the other things that happened. So high-risk maternity, I can finally have my baby with me again, which is nice. And this nurse that's awful, who's scared of what I have going on, she's letting me know that I'm still an ICU patient. I'm like, I'm not. I didn't have any like constant drips happening besides these nerve blocks. I had like PRN, IV Tylenol, and they were still trying to give me like IV potassium or IV magnesium here and there, but I really didn't have anything that was constant. She's like, so I'm not taking care of your baby because your baby's discharged. So that's on you guys. And very serious about that. I'm like, okay, I'm not asking you to take care of my baby. And then she wanted me to get up to the bathroom a million times. Oh, and when I was waiting for them to accept me in high-risk maternity, I was sat in a wheelchair in the room. And I was supposed to be transferred quickly into a bed because I have dependent edema issues because of all this fluid and this hematoma and the DIC. And I have this horrible big black crotch. Mind you, I was walking in the ICU. I was able to walk with physical therapy. When I went to high-risk maternity, because they sat me in that wheelchair so long, hemming and hawing about whether or not they're going to take me, everything swelled in my lower region. And then when they tried to move me into the bed, I felt a sharp pain in the front of my pelvis. So I think they tore or stretched my symphysis pubis ligament, and I still have pain to this day. So I think I have some kind of tear that happened because it was like a sharp, horrible pain. And I was like, stop. And it's like I was able to walk in the ICU. They just didn't want to wait for me to like do what I needed to do to sit myself in the bed and turn. They were trying to help me and go faster. And so they, didn't have my pelvis aligned perfectly when they did it. And it jarred something, severed something, I'm sure. So, now I have this horrible front pelvis pain where I feel like I can't walk again. And it's horrible pain. And she's wanting me to go to the commode. And I say to her, I'm like, yeah, no, I'm just going to use a PureWick. And she wouldn't accept that. Like, it's her fucking choice. So I was like, fine, I'll show you what it's like for me to go to the bathroom. And it was a painstaking process, and I did not let her touch me. I'm like, you're going to be hands off for this? And she just kept saying like, well, I have a better way we can do this. There's an easier way we can do this. We can turn you, like I'm not a nurse and I don't already know that. It's like, no, every time you people touch me, you hurt me severely. And I'm not being a baby. It's like something's wrong. So just stay hands off and let me do it slowly. And I got myself into the bathroom, and it was horrible pain. And I just started crying in the bathroom, and I was like, this is so unfair. And she's like, okay, let's not have this meltdown here. Let's go back to the bed. I was like, okay. Just totally unsympathetic. Telling me at the same time that she understands exactly because her husband almost died of a heart attack. I'm like, yeah, so that's a natural event. What happened to me was malpractice. And I've been told the whole time that I should be so thankful for this malpractice that I've barely survived. And I'm totally damaged for the rest of my life, Like, I feel maimed as a woman. I don't really even feel like, like normal postpartum. Like, your uterus will shrink and you'll have a period for a while and this, that, and the other. And it's like, I don't have that. And it makes me very, very sad because I was connected to my body. And that might seem ridiculous to some people, but I think if we chopped off a man's penis, he'd be fucking emotional over that. And your uterus is involved in sensation too. So, for them to think that your life will be the same after your uterus is gone is insane. It's not the same, Like, sexuality is different now. And I just have to live with that. You know, and I'm like, thank God my baby's alive, because I don't think I would even care to heal. Like, I think I would just be completely depressed. But she's alive, so I have to stay okay for her. So, yeah, and she was arguing with me about how much blood I actually bled out, and she didn't believe me. And then she was like silencing me anytime I tried to tell her what happened, and I just kind of gave up trying to explain things to her because it just seemed like she didn't believe anything I was saying. So I was like, I just gotta survive this 12-hour shift with her, and then I'll get a different nurse, and I'm never gonna have her again. So she, like, I was getting up to use the bathroom, I think, and my husband was trying to take care of the baby, but the baby was screaming, and I needed help to get to the bathroom because it's very hard to move, and I just need people to, like, clear my path and open the door and give me my walker and stuff. And she hears the baby screaming, so she comes in and immediately scoops the baby up for my husband. After just telling me, like, this 30-minute lecture of how she's not going to help at all with the baby because the baby's discharged, she takes my baby from my husband and wraps the baby up and soothes the baby. And, of course, the baby calms down immediately, so she's thinking she's amazing and we suck as parents. And, you know, I can't focus on the baby crying because I have such pelvic pain and so much pain just trying to get to the bathroom. So I'm just trying to get myself there and get back, you know. And she's shaming me while she's holding the baby and saying, well, you are a first-time mom. You know, she kept saying that. And I'm like, I'm not even, like, an intact human right now. I can't do anything for the baby right now. I'm trying to breastfeed her, and that's all I can do. I couldn't change a diaper. I couldn't, you know, put her in clothes. I couldn't swaddle her. I couldn't do any of the things. Like, I expected that I would be the only one touching my baby. And then everybody else has their hands on my baby but me, and they just get to scoop her up whenever they fucking feel like it. And she's sitting there shaming me like I don't know enough, and I'm a first-time mom. Mind you, I'm 29. I grew up on a farm taking care of baby animals my whole life. I also took care of baby humans my whole life, babysitting, you know, church, nursery, things like that. Changing diapers and feeding babies and all that kind of stuff. And I'm a nurse. Like, I've taken care of them medically too, and put IVs in and all that stuff. So I was like, I know how to take care of my baby. And I read 7 books while I was pregnant about how to take care of your kid the best way and how to birth the best way and all that stuff. So it's like, I am not going into this blindly. Like, yes, I'm a first-time mom. And I said to her, you know, I'm not ashamed to ask for help if I need it. You know, if there's something I'm not comfortable with or I don't know the answer to, I'll ask about it. But I'm very educated and I know what I want to do with my baby. And she was just like, yeah, but you're a first-time mom. Like, you don't know anything. Like, here's this baby going off to this woman who's not going to be very good. Like, just anything she can do to put me down. And she also told me that I'm going to be very emotional about your case when I get home. But right now we need to, you know, do XYZ, whatever was on the agenda. I'm like, you're like the least empathetic person, stone-faced. I was just amazed that she was a nurse. And apparently she was a really good nurse, according to the nurse that was giving me to her. I'm like, she sucks. She's terrible. She doesn't know the first thing. She can't even look up a medication. She can't be bothered. And mind you, their max ratio is 3 patients. And I was apparently the most complex one. So I'm like, you guys can't do shit. You know, it was like, I feel like a lot of my CNAs in the ER could do more than what these nurses were doing for me. So anyway, she gives me off to the day shift nurse, who I end up really liking. Her name was Marissa, the day shift nurse. I should start saying names, I think. And the day shift nurse, like, had a Disney thing on her name tag. I remember that. She was very nice. And this nurse that I hated, Anne is her name. She was, or Annie, one of the two. she was like, yeah, the chart says she only bled 7 liters, but she thinks she bled 12. She said it's in the chart somewhere. I couldn't find it, which is ridiculous because it's easy to find. And she's like, yeah, and I was trying to encourage her to walk more, but she's saying that she's having too much pain for that, from them moving me into the bed too fast. They're the ones that made me have so much pain that I felt like I couldn't walk anymore. And to this day, I have pain, and I'm tough. So I do think that if I had an MRI of my pelvis, it'd probably show some damage to the ligament in the front of my pelvis. And mind you, my baby was stuck in my pelvis for 5 hours, so, it was already sensitive, and then they tweaked it. So anyway, she's like, yeah, I want to encourage her to go to the bathroom, but I tried to get her to go to the bathroom, and it definitely looked like it hurt her. So then she gave a report, and then she was gone, and I told that next nurse, I was like, I never want her as my nurse again, because this nurse was Annie. She was like, I'll be back tonight, and I'm like, fuck. All the while she's telling me, you need to get sleep, and then waking me up a million times, and I'm not going to help you with your kid, and also, you're a terrible mother, and this is your first time with a kid, and you suck. Here's how you swaddle. It's like, I can't swaddle. Like, I have phlebitis in my arms. I can't fucking bend my arms and extend them all the way. I'm very weak right now. I just got my blood put back in me. Somebody else's blood is keeping me alive right now. Anyway, Marissa was a lot nicer and listened more to my story and just had more of a sense of humor about things and would work with me. And if I asked for something, I also asked Annie for a psych consult. And then she immediately went into like, well, do you feel like hurting your baby? I'm like, no, I don't. And I also don't feel like hurting myself. I just survived craziness. I just think that that's what anybody should get in this situation, because I'm so amazed at what I just went through, and nobody seems to care. And, I'm going to be high risk for things like postpartum depression and psychosis, actually, because I've had a lack of blood flow. So, but even this other nurse, Marissa, she had me for like 3 days or so. She would say things that were rude. Like, I would say to my husband, like, heat up a bottle for the baby, from our stash that we were making, and also from this donated breast milk that we found through Facebook. And she's like, well, not in the microwave. I'm like, obviously. Like, don't freaking do that to me right now and act like, I got to teach you all these, like, basic things. Like, this is how you put a diaper on a baby. It's like, I know all these things. I'm like, I could intubate her, I'm not your average mom. I know all there is to know about her. I'm very well aware of baby health and baby safety and all that stuff. And so I just kind of came unglued at her for even suggesting that I needed to be reminded not to put a bottle in the freaking microwave. So, because I'm a first-time mom, and I might not know these things. I'm like, you wouldn't even be aware of what I'm doing with my baby if I was home. The only reason you're aware of anything is because, I suffered the malpractice I did, and now I'm stuck here until I'm well enough to go home. And so she kind of backed off after that. But, over time I was able to walk again with physical therapy. But I just, like, my crotch was so huge and swollen and black. And then I had blackness up to the sides of myself. And it's like they finally did a full assessment on me, and they're like, oh my God. And it's like, yeah, I've been through hell. It's like the whole time people just, I guess they thought I was being ridiculous or something. And these nurses that want me to get up and walk, you look at them and it's like, do you guys get up and walk? They're definitely not active people. And here they're telling me how to be active, and it was just like, God, the reason why I'm not getting out of bed is because I'm in extreme pain from what you guys did to me. So be a little patient and understanding. Like, trust me, I want out of this bed. Trust me, I want to go home. If I'm not doing a lot of walking, it's not because I don't understand the benefits of walking. It's because I'm in severe pain. And even then, I was still pushing myself and still getting up. And it wasn't until like day 9 that I pushed the baby's crib thing into the hallway and walked around with the baby's crib and kind of had some resistance like that. And I was doing like little leg exercises and stuff. And I was like, okay, I can be myself again, because, you know, they were threatening to kick me out of the hospital. And I was like, I still can't walk. So I pushed myself like the last night I was there to get myself up to speed. And then day 10 is when they finally sent me on my way. And then I had them send me with a commode and a walker, because I didn't feel safe to just walk without any kind of assistance. I was very unstable and I had horrible pain in my pelvis. So each step was hard. And then the commode is just so that I could have the bathroom near me if I needed it. And also because I had to, like, the bathroom that I have in my house is kind of cramped, so it's hard to get in there. So I thought, I don't know if I'll be able to like stretch my legs out that I need to with this crotch that's so swollen. So that's why I had the commode sent to my house. Yeah. And in high-risk maternity, they also woke me up a million times, and I was getting lab draws at like 2 a.m. to check my normal magnesium. And I was like, okay, that needs to stop. Who isn't like watching these orders and checking what's necessary? Because as a nurse, that's part of your job. And as a doctor, obviously. So I had to tell them, like, these orders are old. You guys need to stop checking my magnesium. That's been normal for days. Like, stop treating me like an ICU patient. I'm healing now, and I don't need to be woken up at 2 a.m, you know? And I was there for 10 days, and I slept maybe 5 hours. And I mean that. I was, like, on the verge of losing my mind, and I kept telling them that. I was like, you know, when I had the Purewick and the canister on the wall, if that canister gets too full, it'll damage the suction, and then you won't be able to use it anymore in that room. And so I was telling the nurse, I'm like, you need to empty this. And I had to tell her 3 times to empty it, because she kept not, like, she was busy or something. She couldn't keep it in her head. And so I just got, like, angry with her, and I was like, if I have to tell you one more time to empty this, the next person that's coming in here is going to be wearing it. And then they finally emptied it. And that's not like me. I'm very much a silent sufferer, and I'll just deal with stuff, and I'm not an angry customer. I'm very compliant. But it's like, the patient should not have to ask 3 times. And mind you, I just had a hysterectomy. It hurts to hold my pee. And I'm peeing all the time because they fluid overloaded me. It's like, these things you should be thinking of. Like, when you round on me, you should check my canister. You should check my vitals. You should check, you know, my fluid status. Like, there's just basic nursing things you should check. Make sure I'm comfortable. It was very hard to get comfortable. I needed a lot of pillows, and at least I brought some of my own pillows. But, yeah, so, you know, the issues didn't stop just because I was done bleeding to death. I still had to deal with horrible staff. And then some people would talk to me, and they were very empathetic, and they're like, gosh, I can't believe you dealt with that. And there were other people who just couldn't even believe me. And I asked the doctor to add to my code status. I'm like, next time I'm bleeding out, you need to just put an IO in me and stop dinking around finding an IV, because that's how people die. And you need to order a mass transfusion immediately if I'm bleeding out. You know, you don't need labs to order a mass transfusion. She's like, oh yeah, for sure. She added that to my code status, and it's in there. She put that as a note, and to put a IO in place, because I had horrible phlebitis on both arms. And I kind of downplay how big of an impact that had on me. But in my ICU stay, I ended up getting my arms ultrasounded, and I had clots superficially to both arms. And they kept doing blood pressures, and the blood pressure would get like really super tight, and I kept telling them, like, can you just put that on my leg? I was like, I have clots all over my arms. And they wouldn't believe me. And then they finally like looked at my ultrasound, and they're like, oh, you do? And I'm like, I've been saying that. You know, I don't know. When I take a patient, I have a little notepad, and I take notes of what the patient's telling me, and then I refer to that while I'm taking care of them. But these nurses just, they wouldn't. And they only have 3 patients, and I was apparently the most complex one. I'm like, man, like in North Carolina in the ER, sometimes I had 6 patients that were all very sick. In Arizona, as a travel nurse, there was one time I had 12 patients in the ER, 4 of which were fast track, but yeah, it was a huge amount of patients compared to what these people had to deal with, and of course that's not safe, and you shouldn't have ratios like that, but it just boggles my mind, these California nurses who are so babied, and then they can't even handle, like, a pretty easy assignment. So, anyway, the baby could stay with me, and I had a lot of emotions about not being able to take care of her fully and having other people help me. And then it was also hard because she would cry anytime I was having pain. Like, if I was trying to get up to go to the bathroom, she would be screaming, crying, and a lot of times my help that I would call in the room would go straight to the baby instead of me. And I'm like, the baby's fine. I'm the one that's in a lot of pain, and I need help to the bathroom, and then I can go back in bed, and then you can give me the baby, and we'll all be fine. You know, but it's like everybody would go to the baby, and then that made me feel guilty, because it's like, why do I have to beg to be cared for? So, but we got it all figured out, and I'm very bonded to my baby. We're still breastfeeding at 14 months. And, you know, if I could have another baby myself, I would. Because that's how much I love my baby. But now I gotta figure out if I'm gonna adopt or have a surrogate. Yeah. And the other thing is, my nurses would try to relate to me and say, oh yeah, I had a C-section. I'm like, if it was just a C-section, I wouldn't be in this much pain. I had a C-section and a hysterectomy, and I had a vertical cut and a horizontal cut, and I have huge hematomas that I'm absorbing, and severely fluid overloaded. So, can't really relate.